May I introduce Dr. Maher Maaytah. He's a senior consultant and obstetrician gynecologist in the private sector in Jordan and Al-Abdali Hospital. He's the head of the department at King Hussein Medical Center, Amman, Jordan, and the clinical associate professor, Faculty of Medicine of Jordan University. He's going to lecture an interesting subject, maternal mortality and morbidity, globally and locally.
Thank you very much for the invitation. Until recently, I was the head of department at King Hussein Medical Center, which is the largest teaching hospital in Jordan. And this subject, maternal mortality, is a big issue in Jordan, and we're working very hard and looking at statistics and looking at surveillance to reduce it. So I'll just take you through some slides to cover maternal mortality globally and the problems with maternal mortality. And then I will tell you about our journey in Jordan and what we have been doing over the last few years and what we are doing to reduce maternal mortality. As you all know, maternal mortality is the death of a woman from any cause related to or aggravated by pregnancy, delivery, or post-mortem, 42 days, and not from accidental or incidental causes. That's the WHO definition. Now, maternal mortality ratio is the number of maternal deaths per 100,000 live births. Unfortunately, every 2 minutes a woman dies from causes related to pregnancy and childbirth, and that's a very sad fact. And again, globally, around 80% of maternal deaths are related to obstetric complications, mainly hemorrhage, sepsis, unsafe abortion, preeclampsia, eclampsia, and prolonged obstructed labor. And complications of unsafe abortion accounts for almost 13% of maternal deaths. The sad thing is that 70% of those deaths are preventable. So if you follow guidelines, if you have good maternity units, if you have good staff, if you have good training, if you have protocols, then you can reduce maternal mortality. Now, look at these figures. I mean, 300,000 almost women worldwide lost their lives in 2017. Unfortunately, most of them in Sub-Sahara Africa, South Asia, accounting for approximately 86% of all maternal deaths worldwide. So you have regions where the maternal mortality is much worse than others. And I'll be talking about that. Again, globally, almost 200, the maternal mortality rate is around 223 per 100,000. That's worldwide. But you'll find high in some regions, low in others. Now, every day, almost 800 women die from preventable causes related to pregnancy and childbirth. And between 2000 and 2020, maternal mortality rate dropped worldwide, average 1.7 per year. And that's what we're targeting. Almost 95% of all maternal deaths occurred in low and low-middle income countries. And that's the sad statistics. And if you look at this slide, you can see that the worst is Africa. The best figures are in Europe, and our region is in the middle. And now, unfortunately, our region is affected by wars, and our statistics is even worse than what is on the slide. And if you look at this slide, you can see the variation. If you look at Europe, I mean, they have excellent figures when it comes to maternal mortality rate. I mean, Norway, Germany, Australia, Austria, UK, excellent figures. I mean, it's sad that they're still losing ladies, but they work very hard on preventable causes, and they have guidelines, and they have confidential inquiries. So they are learning the lessons. So they're studying the cases, they're putting some protocols and guidelines, and they're following them. But if you look at Nigeria, for example, Congo, Afghanistan, where they've been in wars for the last 30, 40 years, the figures are much worse. Now, if you look at the countries, now I can tell you that the two Arab countries that they have good statistics related to maternal mortality now is Jordan and Egypt. Why? I'll tell you in the next slides. But this is what is being published by the WHO. Again, if you can see, some countries have very bad statistics while the others. Now, the Gulf region, they have good statistics because they don't have many deliveries and they have money and resources. Our region is in the middle. I mean, Jordan was reported as 41, but I'll go through our statistics. It's less than that. Palestine was reported as 20. I'm not sure what's the accurate figure, but if it's 20, then compared to the neighboring countries, this is a good figure. What are the main factors that prevents women from receiving or seeking care? Because at the end of the day, if she fails to seek care, then that's the problem. And we've heard about preeclampsia earlier on, and it's still one of the main causes of maternal mortality. Obviously, poverty, distance to facilities, lack of information, inadequate and poor quality services, and cultural beliefs. All these factors will make it difficult for a lady to go and seek medical care. Now, the high number of maternal deaths in some areas of the world reflects inequalities in access to quality health services. And there is a huge difference between countries, as I demonstrated in the previous slides. So, ranging from 462 to 11 per 100,000. So a huge difference in figures. Now, again, as you know, there are the Sustainable Development Goals. We need to identify the number and causes of death, and the target is to reduce maternal mortality worldwide. That's the aim, and so that it will have better figures, and you need a reduction of almost 11% every year to reach the targeted figures that the UN is looking for. Now, I'm gonna, in the second part of my talk, just to cover the Jordanian experience with our journey with maternal mortality, and I'm very proud to say that we worked very hard, and I'm part of the committee or the higher commission with maternal mortality, and we have different committees. And at the end of, we managed to publish 4 reports covering 2018, 2019, and 2018, 19, 20, 21. So our aim is to establish a Jordanian maternal mortality surveillance and response system. And what we mean by response system is to look at cases, learn the lessons, and put protocols and guidelines to reduce the maternal mortality. So as you know, Jordan is a population of almost 12 million people, women of reproductive age 2 million, total fertility rate is around 2.7, number of deliveries around 200,000 per year, plus minus. We have good health system. Most of our ladies, they deliver in hospitals, and cesarean section rate, it's reported here in 2018 as 25.8, but I will argue that it is higher than that. If you look at the private sector and the public sector, it's around 40%. So it is high. And if you look at Egypt, for example, I was surprised to hear that the cesarean section rate is 80%. And that contributes to the maternal mortality, because if you are doing high rates of cesarean section, then obviously you are going to be facing placenta accreta, you're going to be facing hemorrhage, you're going to face lots of problems, and it will reflect on your maternal mortality rate. So definitely, we have high cesarean section rates in our region. And that's something that is challenging for all the obstetricians here, Jordan, Egypt, everywhere in the Middle East. And that's why 2 years ago, we had a MENA PAS meeting, which is a placenta accreta spectrum meeting in Egypt. We want to learn the lessons. We want to know what are we doing, how can we reduce the cesarean section rate, because placenta accreta spectrum is a challenging problem in our region. And it's everywhere, by the way. And we had a meeting in Amman last year. Maybe some of you attended that meeting. We're going to Riyadh next year and to Baghdad the year after. So this is before our project. That's the reported maternal mortality in Jordan before we started our confidential inquiries, if you like. And as you can see, it ranged between 73 to 19 based on surveys and estimates by the WHO. And unfortunately, the WHO will report some figures, but they're not accurate, especially in our region. So what happened is, by law in 2015, there was a bylaw 10 which was approved in 2015 that all maternal deaths had to be notified. So any maternal death in Jordan had to be notified to the Ministry of Health in the productive age 15 to 49. And it's all the responsibility of the Ministry of Health. So it's a national system, to quantify maternal mortality ratio, active surveillance, assign main cause of death. That's the most important thing. So we will know what's happening in the kingdom, because in Jordan we have tertiary hospitals, but at the same time we have peripheral hospitals in the south and in the north, and they are not well staffed like teaching hospitals. So it's important to know what's going on and define contributing factors and response to avert similar deaths. So that's the main, to report the cases, look at them, study them, learn from them, then response, and then hopefully we will work on reducing the rate. So the target is to eliminate preventable maternal deaths. And this is the process that we were following. We have all the hospitals by law had to notify a maternal death with that certain age within 24 hours, then identification with 72 hours, all reported by computers, and then the facility or a committee will review all the deaths, household, national, at the level of the facility, analysis are done, response dissemination, and then monitoring. And it's all was designed as a secure web-based application, so all the information which was reported is confidential. And as I said, report, generate timely maternal mortality data, quantify the maternal mortality ratio for Jordan, and then work on the response, identify avoidable factors of maternal deaths, and formulate an appropriate response to avert similar deaths in the future. And when I go through the reports, I'm sure you will feel that you will have similar problems here in Palestine. Now, we followed the WHO, or what's been reported in the literature about the 3 delays. So either a woman will delay in deciding to seek health care. If she has headache, for example, she will stay at home 2-3 days, and then when she goes to the hospital, she will be, they will find that she had preeclampsia. So a delay to seek health, delay in reaching the hospital, and then the third one, which is the problem, is delay in receiving adequate health care. The project was launched in 2018, and so far I'm very proud to say that we managed to publish 4 reports. 2018, as I said, as you can see, 2019, 2020, 2021, and now we're finalizing the report covering 2022. So what did we find? And if you look at this slide, you can see the number of maternal deaths, number of live births. And remember that you have to have a ratio per 100,000 deliveries. So in 2018, we had almost more than 207 deliveries. And unfortunately, we had 62 deaths. These are confirmed maternal deaths. So that will make the ratio 29.8. In 2019, we had 63 deaths, and that's the total of deliveries. So the ratio went up 32.4. 2020, we had 53 deaths, the ratio is 30, but we had less deliveries. And the last report, we had 56 deaths, 29.8. So we can confidently say that the maternal mortality ratio in Jordan is around 30, plus or minus. That's without the COVID. Sadly, I'll show you the next slide, that in 2020, if we include, now lots of countries, when they publish maternal mortalities during the COVID area, they published 2 reports, one with COVID, one without COVID. So if you looked at the without COVID, we confidently can say that it's 30, plus or minus. So we need to reduce it. But we did not reduce it because it takes more time to reduce maternal mortality. And maybe we're better at reporting now. But sadly, if you look, in 2020, we lost more COVID cases, and the ratio with COVID is 38. But the worst year was 2021, and look at the ratio, 85. So we lost almost 100 ladies with COVID. So we did not do very well in Jordan when it comes to pregnancy and COVID. And maybe lots of countries did not do very well as well, because we're not familiar with how. Anyway, maybe at the end we managed, but sadly COVID was disastrous for pregnant ladies in Jordan. Causes. If you look at that, 2018 postpartum hemorrhage, followed by cardiovascular, followed by pulmonary embolism. 19, hemorrhage, pulmonary embolism, hypertension. But look at 20, COVID-19, COVID-21, COVID. So COVID was #1 killer of pregnant ladies in Jordan in 2020, 2021. But postpartum hemorrhage is still the top. Why? I'll just show you. 17 ladies lost their lives from hemorrhage, 18 in 1911, 26, 13. Most of the deaths happened postpartum, 60% or more, 75%. Postpartum is a very critical area. And I'm sure if you do proper reporting in Palestine, you will find similar data as we did with what we've done. Now, delay in receiving care. Look, delay in receiving care rose almost 41%. That's bad. So that means the woman goes to the hospital and she's not receiving an appropriate care. Why? Maybe because there is a lack of standardization protocols, the lack of senior obs and gynae experts, a delay in determining the proper clinical decision. And that's been reported in the confidential inquiries of the UK years ago, that the juniors do not talk to the consultants. By the time they talk to the consultant, it's too late. The woman dies from bleeding. Some hospitals that don't have blood banks. This is a summary of 21. As you can see, the rate is 30 almost. This is the number of deliveries. COVID was a problem, postpartum hemorrhage, pulmonary embolism, 75% avoid. This is just to show you that the maternal death by timing of death, as I said, most maternal deaths occurred in postpartum period. So postpartum is dangerous, and you need to make sure that after delivery you need to observe the woman. Most of the deceased women had 4 and more antenatal visits, and that tells us, maybe like Palestine, the woman will have 10 visits, but you don't have people doing the right thing in the antenatal clinic. They do scans, but they don't know, they're not very qualified to do a proper scans. I mean, in Europe, in the UK, I trained in the UK, we offer 2 scans. At the time when I was in training, early scan and detailed scan, and if they need more scans, they will have more scans. I was surprised to hear in Ireland that you offer 4, or is it in your clinic that you offer 4? 2. But if it's IUGR, then you offer. Okay, sorry. Maternal deaths by mode of delivery, we found that maybe 50 or 60% of those ladies who died, 60% of them had, plus minus, had cesarean section. So we have a problem with the cesarean section. Is it the indication? Is it we don't have proper assessment? Is it the anesthesia? This is an area that we need to investigate more. Direct or indirect causes, as you can see, the direct causes are higher, but the important slide here, if you look at avoidable, look, 69% avoidable in 18. In 2019, 82% are avoidable. So if we work on the avoidable cases and reduce them, then our maternal mortality will be like Europe. It will come down from 30 to 10 or 15. Again, there is a delay in level 3. So the lack of standardizing, as I said, the protocols, lack of senior obstetricians, delay in determining the surgical decision. So I think it's very important to work on the response. So what are we going to do about maternal mortality in Jordan? We need to study. We need to look at the community, the facility, national level of response, and we have to have a plan, short-term and long-term, and hopefully bring it down. These are the kind of response that we're working on. Adopt strategies to address the most common causes of maternal death. Obviously, hopefully we're not going to have COVID again, but we need to address hemorrhage, preeclampsia, pulmonary embolism. We need to adopt strategies to enhance the quality of antenatal care. We need to reduce unnecessary cesarean section, as I discussed earlier, and we need to increase the uptake of quality and effective family planning methods. And these are the strategies that we're working on now. And again, we need to work on the quality, evidence-based medicine protocols, safe and adequate blood and blood products, documentation and quality of data. We need to work on adequate qualified staff. We need to continue capacity building is needed, and these are the pathways that we're working on. And to be honest with you, I think we would not have done that without the support of US aid in Jordan. I have to accept that, and I have to admit that, because as you know, all our governments are the same. You have to have some support. And the US aid supported us on these projects, and they're still supporting us, but they have a 5 years period, and after that, we have to depend on ourselves. Now, what are the path forwards? That's what we're targeting, and that's what we're doing to take this project forward. So, maternal mortality guidance principles for response. Obviously, we have to look at avoidable factors. We have to follow evidence-based medicine. We have to look at our actions, feasibility, resources, health system readiness, and establish a timetable, immediate, short, long-term plans. And we have to integrate recommendations. We have to decide how to monitor progress and how effective is our plan. We have to monitor to ensure recommendations are being implemented. And these things are very important. Now, maternal mortality reduction require concerted efforts from all levels of healthcare system, from the community up to the central headquarters of all health stakeholders. And obviously, maternal mortality reduction takes time. You cannot do it in 1 or 2 years. We're looking at maybe a 10 years period before we are confident that we can reduce it. And in conclusion, unfortunately, maternal mortality remains a critical global issue that demands urgent attention and multi-sectorial actions worldwide and to end preventable causes of death. Jordan succeeded, I think, in establishing a system that provides accurate data for evidence informed decision making, and we succeeded, or Jordan has the capacity and commitment to implement this system, and dedication for timely reporting and appropriate funding are essential if we want to succeed. No woman should die while bringing life into the world. I thank you very much for listening.
شكرا دكتور ماهر، محاضرة جميلة كانت، ونشوفك كل سنة إن شاء الله.